Wellness Wednesday. My name is Temitope Akinyemi. And I am the moderator for today's Wellness Wednesday question and answer session. I'm a pharmacist by training, so I guess that kind of qualifies me to merge myself with the people on the panelists. So, I'll be introducing our panelists, and in no particular order, right? I'm recording. And in no particular order, I would like to welcome all the way from Southwest Nigeria. We have Dr. Olushayo Ogumola. You know, I particularly love her, you know, I don't know what to call it, right? She's a nurse and midwife, and she has a PhD. Isn't that just amazing? Okay. I mean, I'm sure she's the kind of person who, if she decides that she wants to do something, she wants to get to the highest level possible. And it's my pleasure to welcome you to today's Wellness Wednesday question and answer session. Dr. Ogumola, you're welcome all the way from Oyo, Southwest Nigeria. You're welcome on board today's panel. Thank you very much for coming. Thank you. Okay, so very quickly, we'll be going to the next person on the panel, and that will be Dr. Uche, all the way, she's a medical practitioner, and she's all the way from St. Kitts and Nevis. I hope I pronounced it correctly. Okay, no voice, really. I believe you can all hear me, right? Okay, cool. Okay, so I think Dr. Ogumola needs to check her internet. Yeah, so, sorry, 1 minute. 1 second, please. Yeah, so Dr. Uche Amefuna Obasi, all the way from St. Kitts and Nevis, is also on today's panel, and she will be doing justice to some of the questions as well. We would love to see your face. We know it's like early in the day, you know, where you are, but I mean, we'll be excited to see your face and to have you contribute immensely to today's session. Okay, and oh, you're welcome, Dr. Uche. Nice to see your pretty face. Dr. Ogumola, can you hear us now? Can you hear us, Dr. Ogumola? I doubt if she can. She's not, her face doesn't show that she can hear me. Okay, maybe you can log out and then log back in. Okay, and then definitely last but not least on today's panel is our very own delectable, she knows that, you know, I have special, I call her, and she just inspires all the time. Our very own Queen of Wellness Wednesday, Dr. Fumi. I know she doesn't need too much introduction, but I mean, she's someone who's been in practice now. I think I can comfortably say that she's been in practice for close to 40 years, right? Fantastic. So, I mean, so when I say she's Queen of Wellness Wednesday, I don't think I'm talking too much. So, I mean, we have and we can see today's Wellness Wednesday is just the women are taking the shine, and we just love it. I mean, it wasn't the plan, but let's just relish this experience, right?
Thank you for having me.
Yes, you're very welcome, ma. Welcome. So welcome everyone. We really need to dive into today's discussion. Please, I would like to welcome everyone and celebrate everyone who's on this call today. I mean, without you being here, we really have no Wellness Wednesday. So I celebrate everyone who is on this call, and I welcome you very warmly. And I would like us to participate. We'll dedicate like the next 10 to 15 minutes of today's Wellness Wednesday to questions that will come from you. So if you personally have any questions on the use of the RIDA range of products for some particular health conditions and things around that, please feel free to type it in the question and answer session of this webinar. But please follow us on this journey. We are going to be taking some of the questions that were already asked about different health conditions as regards to use of the RIDA range of products, and just see how many questions we're able to cover within the time that we have. So I'll just dive straight into it, and I believe that anyone who wants to take a go at whatever question I ask will just go ahead so that we can see how much we can cover. I really need to know whether Dr. Ogomola can hear me yet. Can you hear me, ma? She's even muted. She's muted. Can you hear me, Dr. Ogomola? Okay, maybe Dr. I know. Can you please help me send her a private message? Okay, I'll send a message to the panelists. She should be able to get it. She should please unmute if she can hear, and then let's know we can hear her. Okay, so thank you very much. I think we can go ahead. And yeah, so my first question here today, please, if you can hear me in the room, for everyone who is here, right? For everyone who is in this room, please, if you can hear me, can you please type 111? If you can hear me, please type 111 so that I can just go ahead with the questions. I need to be sure that every other person who is in the room can hear me. Fantastic. Okay, so we just go ahead. We just go ahead. Thank you very much for the feedback. So the first question here, yeah, the first question here says, when was RIDA established? When was RIDA established? Who wants to take a go at that question? Ooh, Doctor, I know you're muted, ma. Please unmute.
Good evening, everyone. Thank you for being here and thank you for having me here. Well, when was RIDA established? RIDA was actually launched exactly 2 years ago, April 2019. And we started with the flagship product, RIDA Herbal Bitters. And following that, a few months later, we had the capsules, and then about a year or so later, we got the different variants. So it started 2 years ago, and this month is our RIDA anniversary, I believe.
Fantastic. Thank you, Ma. Thank you for that. So I'm sure that's okay, great. Okay. I'm sure that's helpful for someone. Okay. So the next question very quickly says, which of the RIDA variants can be used to boost one's memory? You know, in this FAQ sessions, you just get a lot of questions. And then you discover that some of these questions, when they ask you the questions, you will need to ask them about 4 or 5 other questions, because some of those questions just don't have a linear answer, right? And you don't just want to slam stuff on people. You need to make clarifications and all of that. And if you don't know this much, please, you need to attend the herbal medicine certification course. A lot has gone in there to educate us on how to engage people and all of that. Okay, so that was just my own commercial break before I go back to the question I was asking. So somebody is asking, which of the RIDA variants can they use for memory loss? So over to you, Maz.
Okay. Does Dr. Uche want to go for that?
Okay, for memory loss, the RIDA variant that is used in treating and managing that is the RIDA betas. The RIDA betas alone can actually do justice to that.
Okay. Okay, thank you very much for that, Dr. Uche. Does Dr. I don't want to add something else to it.
Yes, thank you, Dr. Uche. Definitely the RIDA bitters can handle that. From what I've been reading though, and with different experiences with the RIDA cleanser, of late, I've come to see and learn that the RIDA cleanser, in addition to the bitters, can also help. So yeah, but the RIDA bitters, I mean, the many of the feedbacks, testimonies we've had on memory have been in people using RIDA bitters only.
Okay,
So,
good. Fantastic. All right, I think I'll just go to the next question very quickly. We want to see how many questions we're able to cover within the time that we have. And please, I'd like to make this announcement again to everyone who is in the room. If you personally have any questions that you would like to ask, now you have access to all the doctors that you've been trying to get in touch with in one way or the other in your mind. Some of us have been wanting to get in touch with them in our minds. We're just wishing, and now have them in the house with us. So if you have any question, please go to the question and answer session and type in your questions there. Okay, thank you very much. Okay, so question number 3 says, what combination of RIDA products can be administered on a sickle cell patient? Sickle cell, someone who is battling or who is managing sickle cell anemia. All right.
yeah, I would like to say that it would depend on the age, because there are certain variants that may be better for certain age groups than others. But on a general note, the RIDA bitters and the balm is what would really help sicklers, because number one, RIDA bitters has antioxidant properties, but then it also has analgesic and anti-inflammatory properties. And we know that pain is a significant symptom or sign in sicklers. So RIDA bitters and RIDA balm. But going forward to the older teenagers and adults, I want to believe that the cleanser could also be of benefit in certain situations. I mean, after using the bitters for a while, there may be an indication to add or for adding the cleanser as well. So I think that.
Okay, and you know what you said reminds me of a woman who had known for some years. I didn't know that her daughter was, battling sickle cell, and she got the bitters for herself. I think the part burner, and then she mentioned to me, "Oh, I have a 12-year-old daughter who is SS. Can you recommend?" I said, okay, she could take, 1 cup and just take with a lot of water, and let's see how it goes. And then she buzzes me about 3 weeks after, and she's just full of excitement about how it's helping her sleep better, how it's helping her have less pains, and so I know, and of course I also know someone else who he's slightly middle age sort of, and is SS, and the bitters have been very helpful for him, and also low dose of the fire. Of course, some of these things impact on performance and all of that. So I just said, okay, try low dose, so that it's not too much on your system, and he's had phenomenal. So he's on it. He just takes it.
Wow.
It helps
so
him.
Fire as well.
Yeah, fire. Yeah. So that's from my own personal. It's an old friend. We've known each other from like when we were young. So it's been very helpful for him, the bitters and the fire. So so that's that about the sickle cell. And I also like to add, of course, if someone, and of course, sickle cell is, as it is now, we really don't have, I don't think we have a cure yet for sickle cell. They talk about bone marrow, transplant and all of that. But we all know that that's not cheap. That's not a walk in the park. And I don't know whether it fully eradicates. I don't know. It's not my line. So so we have within the RIDA range of products, we have a package that is for sickle cell management. So if you have someone, since it's something they're going to be taking over and over, and it's good to encourage them to get the sickle cell pack. That is cheaper for them, and they can use over a period of time before they have a refill again. So we have a pack that helps to manage people who have sickle cell. Okay. Yeah, and then that reminds me on a not so funny note. There's someone I also heard about who, I've forgotten the name of the condition. Right. They say it happens to male SS people, where they just have a situation where they have a permanent erection, sometimes for
Okay, priapism.
Ma'am?
Priapism.
Yeah, priapism, correct.
It's a persistent, painful penile erection.
Yeah. So and this person walks into the office and just keeps talking about RIDA and how it's been helpful and how he's had this priapism and all. So I mean, some people who manage sickle cell, it's just good. Just take it. It's very good for management. Very good. Yeah. So my fourth question is, what variant of RIDA can best treat breathing issues? That's breath seizures. Someone who's battling issues with breathing, maybe shortness of breath and associated issues with breathing.
I would also advise such person to still use the RIDA betas. And then depending on the age, if the person is in the early teens, that means the person can swallow some tablets. So the person can also add cleanser to it to prevent infection. And if there's already an invasion of any form of infection, it can also help to eradicate that. But first and foremost, the betas have proven to be very, very effective in that area.
All right. Okay. Thank you very much, Dr. Uche. Anything? Do you want to add anything, or she's just on point?
Oh, she's definitely on point. Just on a general note, I mean, if a person is having breathing problems, it would be good to see the doctor, get a full assessment, have investigations so that we know what exact breathing problem and what's the likely cause. But definitely on their way to the hospital, before they go to the hospital, and even after, use the betas and the cleanser.
I like that. Thank you, Maz. Okay, so the next question says, does RIDA bitters contain iron? Yeah, and this question leads me to, a time when someone was telling me about a particular herb that, a particular element in the herb that he reacts to, and he was asking me, oh, is this present in this, So when a person is asking this kind of question, you know that the person has probably had, an experience that was not so, so I think we can go ahead because RIDA bitters contain iron.
I'm not aware that it contains iron. It contains a number of nutritional elements, vitamins, but iron is not one of them as far as I know.
All right, thank you. We can see the questions are trickling in, so we need to try and see how much we can cover before we take the questions that people are asking. Okay, so next question says, can RIDA balm be used to treat cough? If yes, how? Some questions, some questions are very interesting.
For that, I will say yes. Okay. But again, in combination with the RIDA betas, the RIDA betas will go inward, does all the cleansing. In fact, will also help the patient to cough out the phlegm. Then the balm itself is to be applied topically. So how? Apply topically on the chest, on the neck area, on the back area. And if it is very bad, for a child that can obey instructions, if you say inhale and the child can obey, all you have to do is get hot water, not too hot, put some balm into the water and ask the child to inhale. So if the child can obey such commands, then you apply that. If not, just leave the rubbing and that will do the work.
Okay, thank you very much, Dr. Uche. Thanks for that. Please, if you have anything else to add, Ma, please just let me know so that we can, so that I can know whether to go ahead or yes. Right. So, someone is asking a very interesting question here, and I get this kind of questions like, I think a bit more often these days. Someone asking me, can a teenager use fat burner? Can a teenager use fat burner?
Fat burner.
Yes.
Okay, maybe I can take that. First of all, it depends on the age. But before I talk about that, obviously the fat burner, the teenager wants to lose weight. And the first advice would be to get the nutrition, the diet right, and exercise. So now the manufacturer of RIDA, the capsules are to be used in children about 15 and above. So if the child or the teenager has been counseled on the right kind of diet and exercise, incorporating exercise into their lifestyle, and still, it's not working, or even if it's working and they want to use fat burner, they can if they're above 15 years.
Okay.
But it would be in combination with, those lifestyle modification methods, because fat burner increases the metabolic rate, and it also, I don't know if it does this for everybody, it suppresses the appetite as well. So yeah, so it can be used if the teenager is above 15.
Okay, thank you very much for that. Dr. Che, do you have anything else to add to that, please?
Yeah, I also want to add that the fat burner is strictly not just for weight management.
Yeah.
If you have high cholesterol, the fat burner has been very, very effective in the area of one having high cholesterol, especially if it is getting to the detrimental stage where it is affecting your daily activities, causing high blood pressure, causing, all the other complications that comes with increased weight. So you can actually use the fat burner to manage the level of lipids in the blood, in the body, not just for weight loss, because I've seen people say, oh, I had a test and I was told I have high cholesterol. I'm slim. How come I have high cholesterol? Yeah. High cholesterol is not only for those that are slim, that are big, that are endowed with flesh. Trust me, you can be very, very slim and you are already a walking corpse. So you have to check your lipid level. If it is high, start treatment. I most of the time ask patients to start with the fat burner too, because it's very hard to get people to comply with lifestyle changes. Exercise, your type of diet, time for eating. In fact, it's very hard to see people comply. So if you know that you cannot comply, or you have kids that have sweet tooth, that have gotten to that age from 15 and above and can swallow capsules and drink lots of water, then the fat burner is doing a good job.
Okay. Thank you very much for that, Dr. Uche and Dr. Aina. Welcome back, Dr. Gumola. I believe you can hear clearly now.
Yes, I can hear clearly now.
Yeah. Okay.
The fat burner question, so that, as it has been said, it's not only for people that want to shed weight. I have some people that use it for constipation. Maybe they have problems using the toilets. So when they use the fat burner, they find out that they're able to move their bowels regularly as expected. And most of the time, when they move their bowel, it's also fat that they will tell me that is coming out also. Maybe excessive fat that are lining the intestine or the bowels tends to come out when they use the fat burner. So people that have constipation, they don't use the toilet every day, the fat burner also help them to move their bowels too.
Right. Thank you very much, Dr. Mala. Thank you for that. Okay, so this next question is a very, very, it's an important question that I need everyone who is in the room to please listen in for the answer. Okay, so as human beings, we like to cast, and I think, of course, when we're taught in school, we're also taught to cast things in a particular way. Education also taught us to cast things in a particular way. Even those of us that went to medical school or whatever school, I mean, we know that when you have a headache, you take a painkiller. I mean, just everything just box, right? And when you have, you know, when you talk about herbals, when you talk about phytochemicals, those are elements that are present in the fact that when you take a single plant, you can actually separate a lot of things from it. I mean, that's why Dr. Aino can talk about one single herb having this property, that property, that property, that property, you know. And when you carry out tests for each and every one of those things, you find efficacy for all of those things. I mean, that's what separates herbal from regular orthodox. But we still battle these things from time to time, right? Our scientific mind, our school, the mind that went to school just battles some of these things. So I mean, when you hear something like Restore for Women, and I think it's been affecting some of our communication as well. When you hear Restore for Women, you just assume in your mind that it is either the person who wants to have children, or the person who has fibroids and wants it to go, or the person who has ovarian cysts. That anything apart from those three people, don't come near Restore for Women, right? Okay, so so somebody is asking this question, and I know there was a time, sometime last year, where we had some amazing testimonies on people battling menopausal issues and using Restore, and how phenomenal they found, you know, the feedback that it gave. And somebody is asking, I believe, against the backdrop of that question, somebody is asking, is the Restore variant good for elderly people ages 70 years and above? So somebody is asking that question, like, at least this person doesn't want to give birth. This person has crossed together. Don't mind me. So, but that's the question. So can we have answers, please? Is it good? I mean, would you recommend it for somebody who is 70 years and above? Is it something that you would recommend? And if yes, how would you recommend it? And maybe why? And there was silence.
Okay, I thought Dr. Ogumola, since she just wanted to go for it.
Yeah.
70 and above women, they are also women, and they have hormones, women hormones that still govern.
I like that you answered, Dr. Ogumola. You have points for that one.
So definitely, since Restore is for women, and it helps regulating the hormonal level of the body, definitely is going to help a lot of women around that age in maintaining a balance in their hormonal level at that age. What I believe is that it's not that maybe they are going to have a surge, or maybe the hormone that operates when they were 40 and 50 will just start all over again, but it tends to balance it for them, making them, like the experience I have with women around that 70 and 80 years old that are having Restore, they will tell you they were able to sleep better. Unlike when they were unable to sleep better, the moment they start taking Restore, they were able to sleep better. Some of them complain of some heat. Some of them have some experiences that by the time they use the Restore for Women, they found out that a lot of things happening in the body as women tends to be balanced somehow. So let me just answer it this way, that if 40, 70, and 80 women, if it will benefit them to live longer and enjoy their health, that's my answer.
Fantastic. Thank you very much, Dr. Ogumola. Thanks for that.
Yeah, what I would just like to add is it would probably be in the use. Maybe a 70-year-old woman would probably at least start at a lower dose, maybe even lower frequency. So normally the regular dose of Restore is 2 capsules a day in conjunction with the bitters. So like bitters in the morning, Restore at night, or vice versa. I would encourage a 70-year-old woman to start maybe 1 capsule 3 times a week first, you know, alternating it with the bitters. So because we know that with the elderly, their response, the way their bodies metabolize different drugs is different from adults that are not, I mean, younger adults. So that's what I would just like to add.
Okay. I remember I've had contact with a number of people in their 60s who have used Restore, and they've had phenomenal. I mean, you don't know, if you're not that age, you wouldn't be able to relate with what they're sharing, you know. But I know I met a woman recently who told me that, who were asking her, "What are you using? You look younger. Your hair is fuller." I mean, for a younger person like, your hair is fuller, it's fuller, no. But you know, with age, you know that something is happening to your body. Your body is not, it's like, I don't want to use the word that comes readily to mind, but I mean, your body is no longer the same. So if there's something that is waking up some things that either were latent or were going down or whatever, you would know, you know, and then people who probably know you closely will be able to tell, you know, that anyone in that age wants to look younger, wants to look, and I've had phenomenal feedback on the skin, on the hair, for people who are from 60 and above. For someone who is younger, I mean, can get away with a lot of things. You don't particularly look old, you know. But I mean, like Dr. Aino said, the body is a lot more sensitive when as one ages. So you want to start with a lower dose, and then as your body
can graduate.
You can gradually increase the dose. I think that's phenomenal. Any addition to that, Dr. Oche, or we can just go ahead? 6:40.
They've done justice to it already.
Excellent. Thank you. Okay. So I think we'll take 2 more questions here, and then we'll rush through the questions that we have in the Q&A session. Okay. This question, though, I think we'll be able to answer this question in 1 minute. This question says, and I think it already has been answered too, even in less than 1 minute. Yeah, somebody's asking which of these variants can be used as purgative. Which of the variants can someone use? Someone who wants to. I don't even like to use the word purge, but people ask, it's people's questions anyway, so it's touching them, so we need to fix it.
I think it depends on the person, because the people's response to the bitters, some people, it actually has a purgative effect on them, while others is different. But one of the variants that I know definitely increases bowel movement frequency is the fat burn, and Dr. Ogumola already mentioned that. So I know that some people who have taken Restore have also reported that, but I know definitely with the fat burner, it is in addition to the bitters, it helps.
Yeah. Okay. So thank you very much for that. I think you've done justice to that question. Let's just rush to the last question that I want us to take here. Trust me, we have loads of questions, okay, but we just like to take this last one. Someone says, what products can be combined with the bitters for someone with back pain? For someone with back pain,
the balm.
Okay, I mean, that's like no-brainer. It's like a no-brainer. Okay, and then of course, when a person has back pain, you also want to check a few lifestyle things. Maybe the chair. I mean, simply the chair you're sitting on for most of the time. Even the bed you sleep on. I mean, some of those small things may actually help to ease things as basic as back pain. But of course, the bitters and the balm will definitely do a sweet job in helping with any form of pain for that matter. So, so very quickly, we'll just go. We have 4 questions here. There's somebody seems to be raising his or her hand. Please type your question in the comments, in the question and answer section, so that we can take that as well. So we'll just get to it. So the first question here says, how can RIDA help with lupus? Have been on the RIDA and balm. Is there any addition? Lupus SLE.
Okay.
Yes.
Lupus, SLE, systemic lupus erythematosus, but people generally call it lupus. It's a condition where the body it's an autoimmune disease where the body sort of attacks itself, and it can come in so many ways. Maybe the person can have skin lesions, rashes, you can have joints inflammation, you can have lesions in your nose and mouth, sores, it can present in so many ways. And the bitters, I believe, because it's one of the conditions that oxidative stress is indicated in. And so definitely the bitters, but I've been studying the cleanser recently, and the cleanser also has strong antioxidants. The cleanser has some of the products, some of the ingredients of bitters, but some others, and those ones also have antioxidant properties. And so I would say that if a person is suffering from lupus and has been on the bitters, I would definitely recommend starting the bitters. But along the line, maybe after a month, if there are any residual symptoms that you feel like, okay, this has not gotten better, the person can also add the cleanser.
Okay, fantastic. Thank you, Ma. Okay, does anybody in the panel does anybody want to add anything else to
Yes, I actually have a patient that has lupus, and the balm also has helped because they tend to also have joint aches. So the balm has helped. So all she does is to massage her body with the balm, and it helps also in that area, aside the intake of bitters. And I also introduced the cleanser, just like Dr. Aino said. And then to prevent the rash, sometimes it comes out, sometimes it doesn't. So she also uses the disinfectant in her water.
Okay. Oh, okay. Okay. Thank you very much for that, Dr. Uche. Thank you for that. Dr. Mola, any addition before we go to the next one?
Well, they've done justice to the question. I just want to add that for the rashes, the bitters can also be applied topically.
Oh, okay.
In case rashes, she has said disinfectant, the purchase said disinfectant. The bitters can be applied topically, depending on the presentation of the patients.
Okay. Thank you, ma'am. We have a question here from Alao Temitayo. And I'm sure, it's a kind of question that we get from time to time. He says, if one is using bitters and variants, is the bitters once or twice? If twice, that means variants should be taken in the afternoon. Is this right? I know that, for this question, I know that even in the medical team, we have interesting views, right? And I know that it boils down sometimes to people's experiences. Sometimes you already hold a view that this, and that, and then somebody has an experience that kind of challenges what you've held there, and it's working for them. They are, so don't mind me. I don't want to. Over to you, man.
Does anyone want to go first?
Let me start first. Talking about the intake of the bitters and variants, I think there is a particular way the company asks it to be taken. The bitters be combined with variants. The bitters is either once daily, and the variants too once daily. Like taking the bitters in the morning and the variants at night, depending on which one the client wants to take. But there are some based on the experience or what the client is experiencing, sometimes you need to change the prescription. Sometimes some clients, I will change the variants to be in the morning, while the bitters comes in the evening. And sometimes I have some clients, like for example, I have a client that is on RIDA bitters, that is on cleanser, and is also on fire for men. He had partial stroke, his blood pressure is high, and they found out that he also is having hiccups. And they found out that the cleanser is helping him with his hiccups. The fire for men is also working, and there's no way, we just need to take the three together for him. It's not that stop fire before you take cleanser or stop this. So what we have to do in such a case now is that if we take RIDA bitters in the morning, the cleanser in the afternoon, and the fire at night. Because the moment you remove the cleanser, the hiccups comes back. So you have to put the cleanser again. The fire at the night, because there's a benefit, is benefiting from taking the fire. So sometimes the prescription is based on what the client is experiencing, the complaint. I used to tell people, just let me know how you are feeling. The product you are taking, let me know how you are, the feeling you have, what you are experiencing, so we know how to adjust it based on your health, based on your age, based on your experience. So we alter some things just based on what, but if the client is not having any complaint, it's okay if the company prescribed it, then there's no problem. Like, for example, I have some people that wants to shed weight, and they will tell me that the fat burner is not working. They're not seeing any difference. So, and I have another client. She came and she told me that she's seeing amazing difference. So, okay, how are you doing your own? Hey, when she told me, child, she was using RIDA bitters combined with fat burner in the morning.
What?
And RIDA bitters combined with Restore at night. And within 2 weeks, her tummy was going down. She was seeing amazing results compared to when she was taking RIDA bitters in the morning and the fat burner at night. So I decided to try it too. Hey, it was tooling 24 hours. Before, by the time I would take RIDA bitters with fat burner in the morning, I will rush to the toilet till around 5 p.m. So by the time I will take it, the student will continue to the next. Whereas she was taking it, and she was okay with it. But normally, I asked them to start with the company's prescribed dosage. And if there's any complaint, we can now work around it to see what can be done. That's how I handle those people that I play on the products.
Wow. Rita, bad boy, everybody. What? Oh, I don't have any comments for that. Please, over to you, Dr. Anna and Dr. Uche.
Well, I don't have comments on that as well, but the company has specified how this should be taken. However, like I just keep saying, in my study of the ingredients of different ones, so for instance, the cleanser, you know, the bitters, the dose we're taking of the bitters, there's a range, 10 to 20 mils once or twice a day.
Yeah.
So if a person is taking the bitters, 10 mils, and taking cleanser in the same dose, at the same time, it would not be an overdose, because a lot of the ingredients in the bitters, some of them are also in the cleanser, and then you have a few extra ones. So I would say if a person was to take, the person can actually take bitters and cleanser in the morning, and then maybe the bitters or the other thing at night, rather than 3 times a day, because we usually we expect that people take those products on an empty stomach. So either before meals in the morning or an hour or so after meals. So compliance will be easier if it's once or twice a day. That's just my contribution to that.
All right, thank you, ma'am. Okay, over to you, ma'am.
I'm good, following.
Okay, nice. Okay, so I believe we've answered this question that says, of course, there's, like Dr. Ano said, there's recommended dose of 10 to 20 mils once or twice a day. The truth is that some people's systems cannot handle twice a day. Right. I mean, I spoke with a friend yesterday who told me that she used to restore for 2 months and with the bitters, and she will take it along with her 4 capsules, you know. I said, as how now? You know, I said she did it for like 2 months and stopped. She had what she wanted to achieve and she was good, and then so I mean, of course, the essence of having this guideline in place is we need to be able to be considerate of safety. We want to be able to, you know, we don't want people to overshoot the recommended. So if people now say, okay, this is how I'm using it, we know that from a company point of view, I mean, this is what is recommended and what was recommended. So on a case-by-case basis, of course, when people check out how it's affecting their body systems, then, you know, we can make dosage adjustment, as our professionals usually say. There's that allowance and the room for dosage adjustment. So standard is once or twice a day. So if you can start with once, if you see that your body is going well with it, there's still that allowance for twice. So twice is still good. Okay, so twice is still good, and then you can go ahead with it that way. And if you need to use a variant, I usually would recommend, I mean, if you've done twice and you're good, you've done twice for some time, for 2 weeks, for 1 month, and you want to add a variant, you can try and add a variant and check it out for 2-3 days. If it's too much for you, then you need to backtrack on one of the bitters and replace it with the variant. You know, so those are the back and forth adjustments that, you know, that needs to be made. And I realize that for people who manage like blood pressure, diabetes, once a day doesn't really work well for them on the bitters. It's not usually as effective. People that have things like that, they're managing once a day doesn't quite, you know, cut it. So I mean, it's just what I've observed anyway. So twice is good, but you need to check it out with once and then, you know, adjust as you go. So second to the last question says, how does the cleanser work? I think Dr. Aino has hit on it a few times, even in for this question and answer. This person is asking, is it for oxidative stress as well?
Yes. A lot of the ingredients in the cleanser, they have they have antioxidant properties. But the cleanser actually is supposed to be also for stubborn infections. They have bacterial properties. They have other properties as well. So yes, the answer is yes, many of the ingredients are antioxidant, but there's also some antibacterial properties as well. So yeah, so I see it as I study the cleanser more, I see it as a slightly more varied version of the bitters, but that can be used in combination with the bitters for a potentiated effect.
Yeah, synergistic potentiating effect.
Yeah.
Take me back to pharmacy days. Okay. Thank you very much for that. I think you nailed it. Okay, so this question, I'll just answer it. The person says, can someone take RIDA bitters and cleanser in the morning and restore at night? I think, you know, with the answers that we've given here, the answer is a yes. Mrs. Dikwe, yes to the question that you asked. So quickly to the next question, second to the last question here, says, some customers are still skeptical about products made with natural herbs like RIDA, saying prolonged use could have effect on vital organs like liver, etc., despite NAFDAC and ISO approval. What else could be used to convince those customers?
It doesn't contain alcohol.
Okay.
Yeah.
Okay.
I need them to understand that it's just like the food that we are eating.
Yeah.
Are just like you are eating your food, and they are already at recommended doses that doesn't affect any part of the body, any organ. They are okay, they are safe. So if like I use the capsule, two capsules daily on regular basis, and I used to go for checkup regularly, and there's nothing. So it's just like me. I mean, it's like I'm eating beans on daily basis, or I love taking a wedu on daily basis. The body will make use of the one that is needed. and the rest is, excreted or expelled out of the body. So it's just like food that we're eating.
Okay. Thank you, ma'am.
Yeah, if we look at the ingredients in many of the variants, for instance, some of them are things that we even use in our kitchen, as well. If I would say, just like with every other condition and medication, if you've been on a product for a while, it is prudent to check out your system, to do a checkup. And that is why we have the Doctor Connect.
Yes, so I've done my own.
So what will convince you is really, you check yourself now, you take your products for a few months, and then you go for a checkup. Even with the regular medications we use, we still need to do a checkup. So I think that would be my response to that.
Okay. All right. Dr. Okay, any comments on that? Oh, you already spoke. You were the first person to speak. Sorry. Yeah.
Just like she said about the alcohol, one of the reasons why, because a lot of the herbal preparations that people take in our environment they are steeped in alcohol. And the alcohol is part of what makes people concerned about their liver, especially. And so that's.
Thank you very much, ma'am. Okay, so for the final question for today, says, which products should I recommend to someone with chronic prostate cancer? Chronic prostate cancer. What products can be recommended for that?
We'll recommend the betas and prostate for men, fire for men. Yeah, the fire for men is very good. Though I still recommend it irrespective of the stage of the cancer. Okay. I have a patient with breast cancer and had been on the cleanser, the cleanser, the betas, and the restore. So hers is in the 3rd stage. She went for checkup late, so it was caught late, but at least she's still here with us. So that's the most important thing. And she has been able to sleep at night, unlike before. She doesn't have the heart palpitation she used to have like before. So, and with the testimonies we've gotten from that of prostate cancer, I think it's actually doing a tremendous job. Just like Dr. Aino said, regular checkup would actually help you catch these things earlier. And if caught earlier with the treatment from your doctor, alongside what we gave with RIDA, would actually help either bring it to a stop or push the D-Day farther away from the patient.
Okay, so thank you very, very much. I don't know whether you found this session very enlightening. If you are still in the room with us and you are just so thankful for all that our panelists have shared with us today, this has been a 1 hour well spent for you. Please, I would like you to celebrate our panelists in the room. I would like you to say thank you, give them a round of applause, show an emoticon, give them some love, and just say thank you. Okay, someone says very enlightening session. Thank you very much. I would like to say thank you very much to Dr. Ainon, Dr. Uche, and Dr. Ogumola. And Dr. Mola, you fought until you ensured that you joined us. We can just imagine what you have to go through, right? I mean, because of my many meetings today, there was one meeting, I was just feeling for the lady. She would go outside, she would go in, she really was just, and we can imagine the sacrifices that, being here with us today has cost, and we do not take it for granted. Thank you very much for your time. We know that people here have gotten a lot of value. People are saying, thank you for this session. So, I mean, it will be our pleasure to be in your faces once every month, take our questions. So please let's invite, and this is a good avenue actually to get some of our skeptic guests and people who just are not sure about, I mean, when they see a medical team on ground, they will know that we mean business, and that business is for health and wellness I like Dr. I don't like to say wellness and wealth. Okay, we need good health to go for our dreams. Okay, so and it's a pleasure to be in your places today. So thank you very much, everyone. Thank you. I would just like to put in some music.
Thank you, Emma.
Thank you. Thank you for having us.
Very much.
Thank you.
Thank you.
Thank you, Dr. Oche. Thank you. I know that your day is kind of still young, so enjoy your day.
Thank you.
Thank you. All right. Have a good evening for everyone.
Know who I am 'cause I'm up the way. Don't you know, don't you? When I become rich and famous,